I really couldn't believe that it would work as well as I was told, and it has.
A lot of people want to know what an OSB device is, and it is basically an appliance that goes in the mouth to help balance oral function, which is swallowing, speaking, and breathing. Hello, Sharon.
Hey.
This is Sharon Donahue. I'm Wayne Whitley. I'm a dentist in Fredericksburg, Virginia, and we're starting the oral systemic balance process. Sharon's here today because she has some things that she'd like to see addressed, and we were talking about them the other day. How about you giving me 2 or 3 of the things that are just bugging you or you'd like to see changed that we're working with your physician on too?
That's started out with, I came in to Dr. Whitley looking for help for issues that I was experiencing, and probably the most important one was a racing heart and pounding heart and feeling like anxious and having panic attacks, even along the lines of sinus problems and not being able to breathe out of my nose. And the more we talked, the more I found out that maybe OSB could help these very issues without even having any idea that it would help a lot of these things. I thought I was just stuck with them the rest of my life.
What we're looking to do is to make an appliance that will balance that oral function, and therefore the other body systems that are in and around the mouth will normalize also. And so basically Sharon's here to start that process with some models, and then we're going to do some testing in a few moments that will help us get some baselines for her, and then as we make the appliance and work with her, she can see and feel the difference, but also we can monitor it quantitatively, and then we can see if we're going in the right direction. We can get back with the physician and work with him in terms of medications that she may be on or may need, and so the process is just starting when we make this first visit. Almost invariably when we take a side view of the patient, x-ray view of the mouth and throat, it's called a cephalometric picture, you see that they've got a 10-gallon tongue in a 5-gallon bucket. The tongue is crammed in the back of their throat, and it's in the way of everything, swallowing, speaking, and breathing. So what the OSB appliance does is help allow the tongue to get into a better position, and the jaw and the musculature follow suit, or the tongue follows the jaw and the musculature, and you have a better balance without a clog, and suddenly breathing is enhanced. A little bit more oxygen never hurt anybody, and usually helps everybody. So what it's doing is maximizing or improving the relationship between all those structures that have gotten clogged up. Dentistry's come a long ways. People first they ask if am I going to have an impression. Well, we have a very easy impression process, even if you have a strong gag reflex. We make a model and take records and have some paper tools or questions that you fill out. Come back and it's fitted. I mean, it's really not a lot of heavy lifting. It's a process. It's an enjoyable process, usually because things are getting better almost from the get-go. Just understanding that you're not crazy or don't have this terrible problem with all this upset that people have been experiencing is a biggie. It's very uplifting and positive, and it's something that people look back and go, you know, I got all worked up over doing something like this and it was nothing.
My main motivation for coming in for the OSB was for a racing heart, for the high blood pressure, for allergies that I had gotten 2 separate allergy medicines for, and now I don't need to take the allergy medicine because of the OSB. I got my heart's better, I don't have the racing, I can breathe better, I'm not having the short-term memory loss like I did, like I thought was related to hormones that I thought I was just stuck with, and just generally all around feeling better from the OSB, and I'm really grateful for it.
And it's simple.
It's effective. It's a performance enhancer. You can't lose. It's removable. You can't, the side effects are so minimal, if any. I mean, sometimes it changes the bite, and we tell patients that in the beginning, and what they lose are all the bad things that they were experiencing that they wanted to get rid of. So I would say the reason I do it is because I can't find anything else better, and I've been the patient and am the patient, and it works for me and it works for the people we see, and I would crawl in this office every day to do it. I get excited about what happens.